More than 1 in 3 American adults, 86 million in all, have prediabetes, and the vast majority of them don't even know it. Prediabetes is when your blood sugars are not normal but are not high enough to be called diabetes. There are no clear symptoms of prediabetes, and that's why many people don't know they have it. Prediabetes increases your risk of heart disease, stroke, and going on to have type 2 diabetes. In fact, 15 to 30% of people with prediabetes will go on to have diabetes within 5 years. Of course, having full-blown diabetes increases your risk for serious health complications, including blindness, kidney failure, heart disease, strokes, and loss of toes, feet, or legs. But having prediabetes does not guarantee you will develop diabetes, and the diagnosis does give you the chance to make lifestyle changes. Let me state that a little differently. Having prediabetes does not necessarily mean you will go on to develop diabetes if you make some changes. Exercise and weight loss are the cornerstones of prevention. Sometimes medicines are needed. Being more active can lower your blood pressure and cholesterol, in addition to delaying or preventing diabetes. One of the best and easiest things to do is to start walking more. Ideally, we should be walking for 30 minutes a day, 5 days a week. Shorter walks also count, and they can add up to 30 minutes if you can't do it all at once. There are lots of small things we can change that really make a big difference, like cutting back on regular soft drinks and juice and drinking more water or calorie-free drinks. Changing snacks from chips or candy bars to popcorn or fruit and eating more salads can have huge payoffs. Portion size is something most of us don't think about. Sharing the main course with a friend or family member or bringing half back home for lunch the next day is a great way to cut back on portions. Frying foods in butter, lard, or shortening adds lots of calories. Using a small amount of olive oil or skipping the frying pan altogether is a better choice. Grilling, steaming, baking, or roasting all use less fat than frying. We're living in a time when more and more people need to use the resources we have more wisely. Eating lots of meat and chicken uses more energy to produce than getting those proteins from plants like beans. This also cuts down on animal fats that make it hard to lose weight. Choosing fish twice a week is an option. If you can't cut out meats, using leaner cuts and chicken without the skin will help cut back on fats. Processed foods like bacon and sausage and hot dogs have become a part of the American diet, and using these foods less often will cut back the risk of prediabetes turning into type 2 diabetes. Diabetes is a serious disease. Having a diagnosis of prediabetes is worrisome, but it can also be seen as an opportunity to make some changes for the better, changes that keep us around to become the elders we need to guide us forward. Speaking of elders, remember to call an elder. They've been waiting for your call. I'm Dr. Arnie Vainio, and this is Health Matters.